Why too much plain water can disrupt health. Hydration, sodium, and hormonal balance. Introduction. Good hydration is essential for life. We are often told to drink more water for better health. And while hydration is important, hydration is not just about water. It is about balance. True hydration means maintaining the right balance between water, sodium, other electrolytes, hormonal regulation. When this balance is disturbed, especially by excessive intake of plain water without electrolytes, it can lead to important hormonal and metabolic disturbances. Today, we will explore how excess plain water can lower blood sodium and how low sodium states can contribute to hormonal imbalance, worsening hypothyroid function, insulin resistance, blood pressure dysregulation. 1. Understanding blood sodium. It is a concentration. Blood sodium is not just about how much salt you eat. It is about the concentration of sodium relative to water. If water intake is excessive, blood volume increases. Sodium becomes diluted. This leads to dilutional hyponatremia, low blood sodium. This can happen even when total body salt is normal. 2. Excess plain water and hyponatremia. Mechanism. Excessive plain water, dilution of sodium in blood, low measured sodium, activation of stress and hormonal systems. This is especially likely during illness or infection, surgery or hospitalization, high stress, nausea or pain, SIADH, inappropriate ADH secretion. In these states, the body retains water more strongly, making sodium dilution even worse. 3. Low sodium and hormonal imbalance. Low sodium is not just a lab value. It is a physiological stress signal to the body. Low sodium can activate RAAS system, renin-angiotensin-aldosterone, cortisol, stress hormone, adrenaline and noradrenaline. This hormonal activation can disrupt multiple systems. 4. Low sodium and insulin resistance. Low sodium, angiotensin II, cortisol, stress hormones. These hormones block insulin action, raise blood glucose, reduce glucose uptake in muscles, functional insulin resistance. So low sodium states can worsen blood sugar control, especially during illness or stress. 5. Low sodium and thyroid function. Low sodium does not directly cause hypothyroidism, but it can worsen thyroid function indirectly. Stress hormones from low sodium can reduce conversion of T4 to active T3, increase reverse T3, create a state of functional hypothyroidism. Patients may experience fatigue, cold intolerance, brain fog, low energy, even with borderline or normal labs. 6. Low sodium and hypertension, the paradox. Many people believe low salt always lowers blood pressure, but physiologically, very low sodium can increase renin, increase angiotensin II, cause vasoconstriction. Angiotensin II is a powerful blood vessel constrictor. This can lead to elevated blood pressure even when sodium is low. So, hypertension is not simply a salt problem. It is a hormonal and nervous system regulation problem. 7. The role of balanced hydration. True hydration means adequate water, adequate electrolytes, balanced hormonal regulation. For many people, especially during heat, physical activity, illness, low carbohydrate diets, chronic stress. Adding a pinch of natural salt to water can help maintain sodium balance, support blood volume, reduce stress hormone activation, improve energy and stability. This supports electrolyte balance, hormonal stability, better BP regulation, better insulin sensitivity, and better thyroid hormone utilization. Important balance and safety message. This does not mean everyone should take high salt. Salt cures diabetes or thyroid disease. Salt replaces medical care. Some individuals are salt sensitive and need individualized guidance. The key message is hydration should be balanced, not excessive plain water and not extreme salt restriction. Conclusion: excessive intake of plain water without electrolytes can dilute blood sodium and activate stress hormonal systems. Low sodium states can contribute to hormonal imbalance, worsening insulin resistance, impaired thyroid hormone conversion, paradoxical increases in blood pressure. True wellness hydration is not just water, it is water plus balance. A simple, traditional, and physiologically sound principle is adequate water with a small amount of natural salt, guided by individual needs, supports electrolyte balance and healthier hormonal regulation. Disclaimer: this educational content is for general wellness information and does not replace individualized medical advice. People with kidney disease, heart failure, or salt-sensitive hypertension should consult their healthcare provider before changing salt or fluid intake. Thank you. Holistic Wellness Foundation. IMFAL. Healing Beyond Boundaries.